To advertise with us, donate sponsorships and suggestions, email us at trendafricatv@gmail.com or call us on 773-312-0318 or 773-756-6678. Remember to also follow and like us as Trend Africa TV on Facebook so you can always catch us live. On Instagram as Trend Africa TV 123 or subscribe to our YouTube channel as Trend Africa TV and click on the notification button to watch previous shows. You can also visit our website for your African news, entertainment, fashion and sports updates on www.trendafricaonline.net. Trend Africa TV, redefining Africa.
Pause a minute for today. Wash your hand clean and pray. Global epidemic day. Corona, people dying every day. Corona, it be virus. Mania, funny serious. Corona, a virus. A chewa, you go lost.
Purchase your track now.
Wash your hand daily with running water and don't stop. Keep away from non-farm meetings and do something, bro. Pray for your enemy, pray for your family, pray for your country, yeah. Don't forget to keep clean with hand sanitizer. Pause a minute for today. Wash your hand clean and pray. Global epidemic day. Corona, people dying every day. Corona, it be virus. Mania, funny serious. Corona, a virus. A chewa, we go lost. China, Japan, man down. Italy, UK, man down. United States locked down. What now? Pause a minute for today. Wash your hand clean and pray. Global epidemic day. Corona, people dying every day. Corona, it be virus. Mania, funny serious. Corona, a virus. A chewa, we go lost. Pause a minute for today. Wash your hand clean and pray. Global epidemic day. Corona, people dying every day. Corona, it be virus. Mania, funny serious. Corona, a virus. A chewa, we go lost.
Welcome to the health segment on Trend Africa TV. I am your host, Empress Mausi. I am going to be joined with my regular professional panel later today. However, I am going to urge everyone again today to share the feed. If you're watching me on YouTube, thank you for joining us. Don't forget to press on the click on the notification button so that every time we come live, you get that notice. If you're watching me on Facebook, please go ahead and share the feed. Thank you so much for joining us. We'll be right back. Don't go anywhere. Don't touch that dial.
Ooh, yeah. Hands bags, a lot of mercy, yeah. I've been told about living like a star. Hotel rich, champagne and caviar, but no one ever showed me the reverse, and that really hurts, baby, it really hurts. They try to sell your body and your soul. Is the price you pay for rock and roll? Hey, and no one understands it, how it feels, for it's so unreal. Oh, it's so unreal. Baby, don't you cry for me. It's an illusion, just an illusion. I thought I knew night the show. Another drink and then you lose control. Oh yeah. But then on stage I feel like fire burn. Oh, there is no return. I'm always on the run. I give it to you, babe, with all my heart. For it's not too late. Oh, it's not too late. Baby, don't you cry for me. It's an illusion, just an illusion. I thought I knew all like should be. It's an illusion, just an illusion. Baby, don't you cry for me. It's an illusion, just an illusion. I thought I knew all like should be. It's an illusion, just an illusion.
Hello, everyone, and welcome again for joining us on the health segment on Trend Africa TV. I am your regular host, Empress Mao C, and today again we're going to be talking about COVID the way forward, and then also talking about colon cancer. Before I go on, I would like to welcome my handsome and beautiful co-host. We are professional panels over here, so don't take us lightly. Well, without much ado, I'd like to first introduce Mrs. Eunice Cromwell. She is a family nurse practitioner and she provides continuing comprehensive health care for all ages and genders while emphasizing on disease prevention. She's also the financial manager of the Ghana National Council of Chicago. Mrs. Eunice Cromwell, thanks for joining us again.
Thank you.
Let's go now to Dr. Edward Ofori. He is an assistant professor of the pharmaceutical sciences at the Chicago and a researcher in mental health and neuropsychiatry. Dr. Ofori, thanks again for joining us.
Thank you for having me.
Yes, viewers, as you can see, I've always been saying have a very busy schedule. Dr. Ofori, me, and Mrs. Eunice Cromwell, we have a very busy schedule, but we have made it a point to take time out of our busy schedules just to give back to the community. We want to educate the community. We all know we have been in a pandemic phase for a while now, and things start getting better and then it gets worse. So we are trying. I'm going to be talking to my co-host, and let's find out any updates on COVID-19. Mrs. Eunice Cromwell, any updates on COVID-19 so far?
You know, actually, I feel like we're kind of going in a backwards direction. It could also be linked to the fact that it is flu season. So in my own practice, I'm just seeing a lot more people who have been diagnosed. When you watch the news, there's people who have like got together to have like parties, and a lot of them are coming back with COVID-19. And then if you can recall when we had our pediatrician who was here, she spoke to us about another disease that's linked to COVID-19, but affects more of the children. I have seen a lot more of that. Kawasaki disease, which is another anti-inflammatory disease, is kind of on the rise with COVID-19. So I do feel like at one point we were kind of going down, but people are definitely not really taking social distancing very, they're not taking it as serious as they used to. So there is quite a number of cases that have developed. So I'm really looking forward to getting the vaccine so we can really get a hold on it, because things are opening up now, right? People are able to travel. I know the airlines in Ghana finally opened up so people could travel. So I'm just very concerned about if everyone's traveling and taking it different places, it's going to get to the point where they have to shut everything down again. And it's just kind of a backwards motion for me, in my opinion.
Thank you, Mrs. Dr. Ofori, how are things looking with the vaccine in terms of price and the release? Any updates on that?
All right. So as we speak now, the news is that we still don't have a vaccine that is approved by FDA or any kind of organization. Even though we do hear in the news that there are certain countries that have approved certain medication, some vaccines, and basically using emergency use to give to certain individuals, but there hasn't been any studies to like comprehensive study, or I should say clinical trials that will kind of provide data to suggest that it is safe for us to have a vaccine as we speak now. In fact, AstraZeneca just paused their phase 3 trial on their vaccine, which I should say is not something that is out of the ordinary. It happens. Sometimes when you're doing the trials, like we mention all the time, you're looking at the efficacy of either the vaccine or the drug, and also you want to look at the safety of it. Now, there was an incident of somebody who got really severely sick from the who was in the trial and got sick. What we don't know is that was it because of the vaccine that got the person sick or not. So that is why they paused the study. And at this point, they're going to do investigation to figure out whether it is actually because of the vaccine, because sometimes somebody could have something that is not triggered by the vaccine. So there are so many vaccines in trial now, but then what I'm going to say is that we should not rush science. We should take our time with things. Otherwise, actually, it's going to create a lot of mess if we get it wrong. Because a recent study says that if a vaccine is approved as we speak now, only about 20 something percent of the people will take it. And part of the reason is that a lot of us feel this is being rushed. And first of all, there's a lot of skepticism about vaccines. And then you rush it and something happens. That's going to be very difficult for some of us to explain, to people to get a vaccine in the future. So I think that is the only update that I have on vaccines. In terms of like treatment options, there are still some trials going on. We call some of them monoclonal antibodies, antivirals, that are still in trials to see if it's actually going to help people with COVID-19. We all know about steroids and their role that they're playing in treatment of COVID-19. Hydroxychloroquine is no more talked about because we ruled that out as not benefiting patients. A lot of hospitals and places of care now have a little grasp of how to treat COVID patients. So if we are still entreating listeners that if you do have any of the symptoms that we described or you know of COVID, you should still reach out to your primary care physician. So thank you.
Thank you so much, Dr. Ofori. Eunice, how is the curve looking right now?
Last time I checked it on CNN, they said that we were kind of, I know maybe 2 months ago, they said we were kind of trending downwards, but I feel like we're kind of at the, kind of like at the same state still. We're not really hearing about a lot of deaths, but over the weekend, there was a tremendous amount of people who developed COVID-19. And like I said, in my own practice, I'm getting a lot more patients who have been tested positive. What I was going to ask Dr. Ofori is that my professor actually told me that she has COVID-19 and they gave her aspirin, 325 milligrams twice a day, and they gave her azithromycin. She's like 15 days in. She says that she's feeling a lot better. And I wanted to ask, is that the standard of treatment right now, just the aspirin and the azithromycin since they've gotten rid of the hydrochloroquine? Or what is it now?
So what I was at is that so the virus itself is not what is killing people, right?
Right.
It is what the body reacts to it, and part of it is what we call the cytokine storm, which we know is actually triggering a lot of clotting, because when they did a lot of post-mortem autopsy about those who died in around the March, they found that a lot of them had clots, you know. So part of the treatment regimen for a lot of places has included anticoagulants or medications that kind of thin the blood or prevent coagulation. So aspirin is one of them, right? Aspirin is an antiplatelet, and it's usually used to kind of prevent coagulation. So it's not the only one. There are other monoclonal antibodies that have been explored to prevent this kind of coagulation, because pretty much if we can pull data and support what we see now, is basically death resulting from these clots, because a lot of the people that are dying, autopsy is showing that there's a lot of clotting or blood disorders.
Yeah.
Thank you, thank you, thank you. So I guess without much ado, we are going to be inviting producer. Should we take a little break? Okay, we will take a little break and we'll and we'll invite in our special guest. Don't go anywhere. Stay tuned.
Hello, Dr. Amina. How be?
Adeo, Adam. How be you too?
How we go do at the course sake of the other time you talk, say you go explain the vaccines thing give me.
Oh yeah. So everybody get immune system which they protect we from infections, right? Take and say the body be house. The immune system be the house security, where viruses be arm robbers. If arm robbers come the house, where the security no make ready for them then yawa. So vaccines be what they train the security to recognize and fight these robbers if them come the house inside. Vaccines there, we start to use no be today If the vaccines help we fight the 6 childhood killer diseases safe.
So why people they talk say vaccines no good?
Abi, I tell you say it no be true. Vaccines be safe, wah. Some people they react badly to vaccines, but that be rare, cry.
Oh, for real? I never know say them be safe like that. But why them still no get corona vaccine?
Charlie Adam, making vaccines and medicines no be easy. It no day like tea bread where them they take one day do It they take time to make vaccines. Sometimes yes safe. This be because them for do plenty tests make sure say it a job. Where it be safe too.
But if it take years, why them say the corona one day we figure them soon?
Righty, research advance wah. So we go fit develop vaccines in much shorter time. Also, sake of corona make pandemic, everybody they put in extra work to get vaccine.
So why them won't try the corona vaccine for only Africans wanna talk?
The friend doctors them talk that thing there. Them no force cry. Where what them talk self no be true. Vaccine trials they go on for UK, Yankee, and other places. Sake of how corona spread, it be best to test the vaccines for every continent. Otherwise, we no go know if it go work give we. In any case, wanna FDA for approve all trials before we go fit participate. So one thing we for do be say, we for make wanna leaders do due diligence before them go accept anything.
Hey, Dr. Amina, I'm sorry. You make about this vaccine thing, pow.
Adam, a day for you. I be you the kai how you go protect your body from corona.
Oh yeah, at the Kaiwa, I go stay house if I don't get anywhere go. I will wear mask if I come out, wash and sanitize my hands and other surfaces, and I will try to stay 6 feet away from other people.
Hello, everyone, and welcome. Thanks for joining us on the health segment on Trend Africa TV. I am your host, Empress Mausi. I am joined by my professional co-panels who are Dr. Ofori and Mrs. Eunice Cromwell. We have the honor of also joining us all the way from Cuba, Dr. Kwabena Boachi. Hello, Dr. Kwabena Boachi. How are you doing?
Great. How are you?
Great. Thanks for joining us.
Thanks.
So I have your biography, which is so long. You have so many accomplishments that I don't want to mess them up. So could you please tell us about yourself?
Oh, just a briefly. So basically,
don't try to be modest.
Yeah, I don't like talking about myself, but yeah. So basically, I moved to America in '96. Finished. Went to University of Buffalo for undergrad. Finished medical school in 2009. Completed my residency in family medicine in 2012 in Tulsa, Oklahoma. I worked in upstate New York from 2012 to 2019, working between an emergency room and family medicine clinics. And now I'm on a deployment to I guess Cuba for now, till the end of the year. Yeah.
Dr. Boachi, you are not very sure where you are. That is very serious. Thank you so much.
Yeah.
Dr. Boachi, how is COVID how is the COVID pandemic being handled in Cuba? Any updates? How is it going over there?
Well, so over here it's a US base, so we have no access to Cuba itself. So there's no interactions. Everyone that comes in is a military personnel or family member. So you do get quarantined for the 2 weeks before you get here, and then when you get here, another 2 weeks when you arrive here. But we have zero cases, so we're gonna try to keep it that way.
Thank you, thank you, thank you. Dr. Boachi, have you
Yeah,
watched we're gonna just go ahead and go straight to the topic. Dr. Boachi, have you watched Black Panther yet?
I have watched it.
Oh,
Yes.
oh, okay. Do you have movie theaters over there?
No, but we have actually I watched it on my way to Ghana when it came out, but we have Netflix, so most of the movie theaters are shut down because of COVID, but most of the
Right.
stuff I get is from Netflix. Yeah.
Okay, so my next question is we are in the wake of Chadwick Boseman losing his life to um, colorectal cancer, and this is a topic that most of us or a lot of people do not pay attention to. So please, without much ado, I would like to give you the platform to tell us about colorectal cancer.
Yeah, so basically, colon cancer is one of the top cancers that most people get as you get older. At least in America, is the third most common form of cancer that people get. Um, so of course, it comes with age. So as you get older, your risk of getting any cancer goes up. So at least in America, it does affect. Actually, worldwide, it affects more men than women, and of course, we know it affects more African Americans, at least in America, than any other race. Now, the saddest part about colon cancer is most of the time is you don't have any symptoms until it's too late. So it is one of those we call silent killers. So most of the time, most people don't have any symptoms. Some of the early signs that most people can get is blood in your stool, because the polyps and the cancers can bleed. So most of the reasons why folks will come to the clinic will be for blood in their stool. So sometimes they also notice a change in their stool caliber. So it won't be as thick as it used to be. It will be more of a thin line. That's because sometimes the mass will sort of block your colon, so the stool size will be a little bit thinner. So those are the most common reasons why somebody will come to the clinic for checking. Now, there are a few risk factors that can increase your chance of getting this colon cancer. Of course, the most common cause is as you get older, your chance of any cancer also goes up. Being African American, like I said, also has some relations to that as well. They believe it's genetics, but we can talk about that as the program goes on. Also, being obese can also increase your risk factors for that, as well as eating a low fiber diet and also eating a lot of red meat. Chronic diseases in itself, like diabetes, heart disease, can also increase your chance for that as well. And like I said, even though the incidents have gone down, mainly in America, it's still a big issue in our communities here. And like I said, it affects African Americans, especially males, more. My personal experience working with African American communities, because checking for colon cancer, we have to go through your rectum. So a lot of men, especially black men, don't like that procedure. For example, I grew up in Dansoman in Accra. So every year that I go to Ghana, I offer free, with one of these mission trips, we offer free prostate and rectal exams. And almost every single male will refuse that test because of the stigma that comes with it, or because of sometimes it is painful if it's not done in a gentle way. So at least in America, the recommendation is to check you at the age of 50. You do your first screening test through the colonoscopy. And then if it's normal, then it's every 10 years. If it's abnormal, based on what kind of polyps and how many they find, then they can either do between 2 years or 5 years. Now, if you have a family member that also has let's say has a prostate cancer at the age of 50 or 60, your chances goes up as a family member for having it. So if your dad or your mom had it, your chance of you getting it is also very high. So we recommend you check it at an earlier age. So for at least for my African American groups and my African groups, I recommend at age of 40. Now, if you don't like doing a colonoscopy, there's a blood test that we can do through the rectal exam. You can do a stool test. It's called a stool guaiac. Now, if that shows up positive for blood, then we can refer you to the GI folks for the scope. Now they have the home kit test that you can do now. It's a stool card they mail to you. You put in your stool sample on it, and then you mail it to the company, and then they will send the results to your provider. And then based on what they find, they can call you for the scope. And so most of the ways to prevent this is to remain active. So we know physical activity decreases colon cancer, eating a high fiber diet, avoiding alcohol, avoiding tobacco, and all those kind of prevention stuff can help you prevent colon cancer. So that's just a quick general overview, and I can take any specific questions concerning this topic. So like I said, actually, I'll forget to add that it's affecting younger people now, especially African men are being affected at a younger age. So we have to increase the application on that topic. In Ghana, they don't really have screening colonoscopies easily available, and even if they do, it's very expensive. And like I said, with the stigma of going to the rectum, most people in Ghana do not go for the test. So when I go to Ghana every year for my mission trips, that's one of the public health education that we do in the churches and then in the community centers. So we bring our stool card, we bring the solution to test for it, and then if there's anything positive, because hemorrhoids can also cause bleeding. So not all rectal bleeding are caused from colon cancers. But at least by you doing a rectal exam, you can check for the prostate at the same time checking for any colon cancers that you might have. And then, of course, refer them to the appropriate providers. Like I said, in Ghana, we are very limited on how much people can go for screening. And even if they can, the cost is also an issue. But definitely, because it's affecting younger folks, more education is definitely necessary.
Thank you, Dr. Boachi. I would also actually, when I heard about Chadwick's passing, I started questioning myself. There's a saying in Ghana that also so I started talking to my partner. I was like, babe, I think you need to go get tested. And he's like, but the CDC says actually we can start getting tested from the age of 50. What if Chadwick didn't have any family history and he was young? He was diagnosed at the age of 36. So what can one do to beat this in a situation like this where there's no family history? The risk factors are very low. There's no family history, and then he hasn't also reached the age to be screened. So what in this case, what do you advise?
So because it's very tricky, like I said, it's one of those silent killers. So by the time you start having symptoms, most of the time it's an advanced age. So I think with Chadwick case, I think they caught it at the stage 3, if I remember correctly.
Wow.
So at stage 3, sometimes it would have spread already. So those are hard to treat. But I tell people, if you start noticing blood in your stool, or you notice that you're having more frequent stools, or if you feel tired, go get checked, because sometimes by going to your provider and just getting a CBC test done to see if you're anemic, that can raise.
Okay, as you guys know, we are live and Dr. Boachi is joining us from Cuba. So, of course, once in a while, he might be kicked out. So, let's get the conversation going. That's all for you. Can you Speak to that.
All right, got it. Can you hear me now?
I hear you.
Yeah.
All right. So one thing I would say about cancers is the fact that you can have a genetic component of it, like your family members can have it, or it could be what we call sporadic. It means it just starts on its
Right.
own. There's no genetic component to it, and therefore the only way, like you mentioned, is to get a routine check. And now that we are aware that it can actually affect, especially Black men at a younger age, maybe we should consider the age that the CDC or whatever organization recommendation gives. We need to kind of review that, because we're seeing that it's disproportionately affecting certain race at a certain age. So I will recommend that maybe looking at yourself, like you said, if you have anemia, you feel tired, any kind of symptom that you don't feel good about, you should visit your primary physician, and maybe if you're lucky, you'll be able to pick up on some of these things before it's too late.
Mrs. Eunice, what do you want to say?
I know that when I was studying this in school, the recommendation is that you get tested 10 years prior to the time your family member was diagnosed. So I think that one thing that is very important is that even if you don't have a lot of family history, as you get into your late 20s and 30s, it's a good idea to have this discussion with your provider and let them know that, you know what, I don't have the family history. And what is less invasive is what he was explaining, which is the FOBT card, right? You can just put the stool on the card, send it to your provider, and at least you can start the conversation. Unfortunately, I've known about 5 people who have passed away from colon cancer, and they've all been very young. And it's always the same scenario. You don't have any symptoms, and then all of a sudden you go and you get this dreadful diagnosis. You're at stage 3 or stage 4, and there's nothing they can do for you. And it's very, very painful, because colon cancer actually can be, when you have a colonoscopy, it's the only thing that's both diagnostic and preventative, right? When you have your colonoscopy, they can remove polyps that could have potentially been cancer and save you from having this type of cancer. So I think that this topic is so important. And that's why when it came up, I was like, I really, really wanted us to address this, because we really need for people to really take it seriously. Go for your colonoscopy. A lot of my patients hate it. They said, oh, the prep is too hard. But what is worse than doing? I know it's difficult. You drink about 2 gallons of water and the solution, and you have to be all the way cleaned out, and they put you on twilight sedation. But that is so much better than leaving your family at a young age. So I just take this opportunity to really encourage our Africans, our Black people, please and please again, do not feel uncomfortable. If you're having bloody stool, it's not something that you should hide. There's a stigmatism, and culturally people feel very uncomfortable when things are going on there, and they want to hide it and they don't want to tell anyone. If you can't tell your spouse or your family member, you should be able to confide in a family practice provider and let them know that this is what is going on so they can help you.
Thank you, Mrs. Eunice. Dr. Boachi, oh, he left again? Okay. So viewers, we'll take a little break and we'll be right back. Don't go anywhere.
Boy. No. She run can you pay myself. Thank Ghana boy, yeah. Cause you come, you done me, You tie me up, you treat me up, you tie me up, you tie me up, you treat me up, you tie me up. What you feel when you're young? Oh, thankful way, I can't walk on, Nankamiko. What you feel when you're young? Oh, thankful way, I can't walk on, Nankamiko. Listen me down, send me your button, what to me to down. Send me your button, more. Miss you was me chose Doing a me, she run no. But I'm fitting me and you whoa. Tell me don't come and meet your mouth. Me don't come and meet your mouth. Yeah. Me don't come and meet your mouth. Oh. Me don't come and meet your mouth. Yeah. She run can you come myself. Tangana boy, yeah. Cause you're gone, you're dummy, oh. You're time me up, you're treat me up, you're time me up, you're time me up, you're treat me up, you're time me up. What do you feel when you're way? What do you feel when you're Otamfui, a cow won't come, Nankamu. It's the name of down. Send me your boot and team, would to try me to down. Me send me your boot and team on. Miss was a, Mitch was a. Doing a me, she run along. Otamfui me, and if you won't. Tell me don't come and meet your mouth. Me don't come and meet your mouth, yeah. Me don't come and meet your mouth, oh. Me don't come and meet your mouth, yeah. She run can you pay myself, but I'm gonna boy, yeah. Cause you're gone, you're dummy, oh. You tie me out, you treat me out, you tie me out. You tie me out, you treat me out, you tie me out.
Charlie, this corona thing slow everything down, eh? When all this go end, make a call Dr. Amina see say she get some information.
Hey, hello, Adam. I hear from you, Chao. How be you and your family?
We all be cool, oh. I hope say you be fine too. I dey call ask some questions about coronavirus.
Sure. What things you want know?
I hear say corona medicine dey wait them they hide them.
Me self I hear, but it no be true. Plenty research they go on to find corona medicine, but this usually they take time. Researchers too they try some of the old medicines, and some they show good promise. We for hope say the hard work will pay off soon.
So what about medicines where people they call immune boosters? Then they fit prevent or cure corona? How about if I take plenty vitamin C and D?
As with all infections, your immune system they help fight corona. You go fit take some food supplements support your immune system. But if you dey chop balanced diet, you dey get enough nutrients. No research they so say taking plenty supplements will protect you from corona. The medicines them they call immune boosters too. Nothing they show say them go protect you.
And what about vaccines?
Yeah, vaccines they help, wow. But that usually be to protect people them no yet get the disease. Plenty research they go on to find corona vaccine, but this usually they take time. People self-start talk say vaccines no good, but that no be true. It be sake of vaccines where some diseases like polio no they worry we again. You know what? The vaccine matter there. I go take my time explain them later.
Oh, okay. So how we go protect one body from corona?
The best way be say you for day house as much as possible. But if you for come out, you for wear mask then day at least 2 meters from other people. You for make sure say the mask they cover your mouth, then nose all. You also for wash then sanitize your hands more times, then make you no touch your face. Take some bleach to sanitize your surfaces. If you feel say you get corona, you for quarantine yourself. You for rest plenty, chop well, then drink plenty fluids. But if you know they make better, then you for call the emergency numbers. If you get corona, it no they mean say you go die. More people they recover quicker. Yeah. We all for follow these simple directions. So say we go protect we than other people from corona. And we no go overburden one of healthcare professionals than healthcare system.
Hey, Dr. Amina, that you shack rough.
Hey, Adam, Sean that thing. Which madam then the kiddies give me.
Hello, everyone, and thanks again for joining us on the health segment on Trend Africa TV. I'm here with Dr. Ofori, Eunice Cromwell, Dr. Boachi, and myself. Thanks again for joining us. Dr. Boachi, I wanted to find out from you. Chadwick was diagnosed in '98, and then he had surgery and chemotherapy, and then the cancer came back in 2000, and he's been handling that to now. How was he able to stay fit to feature in the Wakanda movie, the what they call the movie, the Black Panther
The
movie?
black.
What could he have been doing?
Yeah. So even with that diagnosis, keeping a good healthy diet and physical activities always makes a big difference.
Yes.
So I'm pretty sure with his routines for the training, I'm sure he did make sure he had enough protein in his diet to maintain his muscle mass. Most likely, he was doing a lot of weightlifting and a lot of yes, basically weightlifting and a healthy diet, high in protein will
Iron.
maintain and also fiber will maintain your muscle mass and keep you healthy for a long time.
Okay. Dr. Ofori, in terms of treatment for colorectal cancer, what should we be looking at?
Okay, so basically, for most cancers, you're looking at either chemotherapy, some kind of radiation therapy, uh, and in this case, I think he went through chemotherapy. I've seen some people that go through chemo and they're able to pretty much kind of get healed in one way or the other if you're able to catch it early. There
Hmm.
was one guy who was interviewed and he basically said he caught his early, and when they were able to, he went through a series of chemotherapy and he's cancer free. So it's basically the go-to treatment is usually chemotherapy.
Okay. Thank you. Eunice, do you have any questions for
What I was going to ask is, so you said the gold standard is chemotherapy. So when do they consider surgery? Because I know that when I used to work in the nursing home, there were a few patients that I had, and they had colostomies, right? So they had the diagnosis, and then they had the surgery. They cut out the portion, and then they had colostomy. So at what point do they decide that you can benefit from surgery versus chemotherapy or radiation?
So what I would say is that when it comes to diseases like cancer, is detection or the time of detection is very important.
Hmm.
Because if you catch it like phase maybe the third stage or something like that, then it's kind of a little too late because you can have metastasis, which is
Right.
the cancer can move to other parts of the body, and therefore it will become basically at that point even if you cut the part of the intestine, I don't think is going to really prevent anything. So early detection is very crucial in this case, and that's the reason why we're here trying to preach that we should go for examination once a year, because that will save a lot of lives than to bet on whether I'm going to catch it and am I going to have surgery or chemotherapy. And most of the time, I think when it's at the early stages, that's when you can consider maybe chemotherapy. But then when it really gets advanced and is blocking a lot of or is about to be metastasis, then you will likely want to excise some part of the intestine.
And also to add to that, sometimes too, if it's found early, like let's say stage 1 or 2, just without any spread into the lymph nodes or any other parts, if you can do an early surgical intervention, that can also help. And but then of course, if it has spread, then sometimes they do the surgery if it's not too widespread, and then they do the chemo and radiation after that as an
So a very
adjuvant treatment.
aggressive treatment.
Correct.
Yes.
Correct.
so I think among the I'm thinking for the men it's very demeaning for them for another man to be I don't know how to put it in the right word without
It's a very uncomfortable. I mean, it's an uncomfortable screening, whether it's a man doing it for them or a woman. I mean, it's very difficult to convince an African American man to do even, a prostate exam, yet alone even tell them to check. Well, even to check for like testicular cancer, right? We learned in
right.
school to tell them that, you're supposed to check your testicles every so often. They kind of look at you like, yeah, no, I'm not going to do that. But it's very important because that's on the rise as well, unfortunately.
Yeah.
So Dr. Boachi, how can we get how can we get more people out to how can we get more people out to go get tested?
So basically, it's all about education, right? So constant education There's prostate cancer month, there's colon cancer month, and then after those months are over, you don't hear about it as much anymore. So what I recommend is frequent education. Putting running with social media is easy to spread information. So constantly having information out there, reminding people, reassuring people that it's okay to have this test done, that will save a lot of people. So we shouldn't give up on the education, especially when it comes to African Americans. Just keep pushing education, keep putting on social media, WhatsApp, any of these kinds of social media, and just encourage people. Now, most of African Americans are also very religious, so going to the churches can also help. So at least back in my church, in the Presbyterian Church of Ghana in Harlem, New York, we do frequent once a month. They give us some time to talk about these kind of health issues. So going to the churches, the local Ghanaian associations also help. At least in New York City, when we have the Ghana Fest and the Ghana Parade, we set up a table and we educate people. So I know Chicago they do have one of these Ghana events every summer. So setting up a table, educating our own people can also make a huge difference.
Dr. Boachi, a few years back when I wasn't when I hadn't gone into health studies yet, a friend approached me and was like, I'm not able to move my bowels as I usually do. And I know we Africans, we believe in herbs. So I was advising her, why don't you just take some laxatives and blah, blah, blah. So with colon cancer, you can still be moving your bowels, but not as much as you would want to, right?
Correct. So sometimes if the mass or the polyp is big enough, it will sort of block your colon or your intestine. So when the stool is coming out, it will be squeezed. So the caliber or the thickness of the stool will be a little bit thinner, and then it'll be much more difficult to come out. So sometimes, like in my previous practice, I'll have some people come in because the stool is not as heavy as it used to be, and it's coming out instead of coming out as like a sausage looking stool, it's like a pencil. This thin, like thin as a pencil. And like I said, sometimes that's only the signs that will come in with, even before they start having blood in their stool. Yeah.
Okay, so what I also want to ask is, how is colon cancer different from small bowel obstruction?
So small bowel obstruction is just your bowel's not moving very well. So there's a blockage there. So with the blockage, you can remove the blockage easily, and then you go back to normal. Colon cancer is not just removed by just removing the blockage. So sometimes it presents the same small bowel obstruction, or it will be more of acute onset. So you're gonna have the nausea, vomiting, the belly pain, the belly distension, and then quickly, and that can happen within a few days or even up to a week. Whereas colon cancer takes years to happen. So, and the symptoms are very slow onset. So it won't give you're not going to have a sudden belly pain or belly distension to go get checked for colon cancer. So small bowel obstruction is acute, very painful. People throw up. Sometimes they throw up stool, like they actually vomit stool. So that's more of a sudden acute onset rapidly. You can diagnose that easily and treat that within a few hours and a few days. Whereas, like I said, colon cancer is a slow onset. It can take years before you have any symptoms.
Thank you, Dr. Boachi. Peljara Agboka has a question for us. She's asking, so if someone was having symptoms and went for colonoscopy, but the results were okay, does the person need to go for the test the following year? Dr. Boachi.
So at least the recommendation here in America is that if your initial colonoscopy is negative or normal, it's every 10 years. So then, if there's a polyp, if they found a mass or a polyp, then based on how many or the size, it can range between 2 years and 5 years. No, but if you have family history, let's say your parent or your sibling had colon cancer, then your time frame will be much less. So within 1 year, I've known some people that had like aggressive polyps, so they were getting checked once a year. There's also other diseases that can cause colon cancer, like Crohn's disease and ulcerative colitis. And so those people actually get tested every 2 years instead of the 10 years because the rate of cancer changes for them is a little bit higher. But on a normal, regular person that is low risk, if your first one is normal, then it's every 10 years.
Okay, viewers, if you have any question for Dr. Boachi or any of us, you can go ahead and type it in the comment section. We will take a little break right now and we'll be right back.
Hi, my name is Ochiame Kwame the Raptor. Coronavirus is a stubborn one, and because of this small virus, the whole world is on lockdown. But hey, hope is not lost. When you need a doctor, you mustn't go anywhere. All you have to do is to call mobile doctors. They will send a doctor to your home, send a fleb to come and take your blood sample.
I will authorize the pharmacist to bring the medication to your home. Don't go anywhere. Mobile doctors will bring everything to you wherever you are.
If you are looking for a discount, just call and give them this code OKMD and they'll give you an amazing discount. Mobile Doctors is my choice and I recommend it for you. For more information, log on to www.mobiledoctors.net. Mobile Doctors, the doctors in your home.
No be wanna photo. Say we dey fight corona.
My guys, I want to discuss some 7 things where people they talk about corona plus you.
You put the worry. You don't say corona really kill black people.
Make you no make anybody lie you. Corona no dislike if anybody cry. True say it start for China, but right there, it catch everywhere where they feel kill anybody, especially people where they get some other sickness. For places like Yankee, corona they kill black people pass. Yeah, Charlie. Some people say they talk say China people with shada do or it be 5G self where they cause them. But shine your eye, it no be anybody do we 5G to no go fit cause the sickness. The 5G self, it dey like the 4G way we all they take browse righty. It just be upgrade. People too they talk say if you get corona we chop plain garlic, onion, ginger and lime, the sickness go. But this one too be lie. This thing's good for the body, mom, but I don't know if it prevent or cure corona.
So what about Sobolo?
Me self, I dey like Sobolo, but into no they do corona nothing.
Appeal to
corona mainly they attack the lungs, so appeal no go fit do am nothing. The truth be say people wey dem dey booze, corona they feel worry them papa. People too they talk say if you cut onions put your room, corona no go come there. But corona no they like mosquito, where go fit kill am plus coil.
Then how we go fit protect our body?
Corona they spread where more people self get, where they no know. So Charlie, if you no get anywhere important go, make you dey house. But if you really for come out, then you for wear mask, then stay at least 2 meters away from other people. If they wash your hands, then use hand sanitizer more times. But I beg, make you no drink them. If you dey call for sneeze too, do for your elbow inside. Take some bleach to clean surfaces where they touch. But this no be for your body. Finally, if you feel say get corona, may go chop for one corner, so say no go spread them. If you get plenty rest, then drink more fluids. But if they make worse, then for call the emergency numbers. Charlie, this be all for today. But if I hear any other thing, I will come back to talk about them. For now, if we make sure say we go protect we, one family, one friends, then everybody from corona. We all for play one part, so say we no go increase the pressure where they want a healthcare system and want a healthcare professionals them at all.
But we for take responsibility and keep fighting with positivity.
Hello everyone again. Thanks for joining us on the health segment on Trend Africa TV. I am your host, Empress Malsi. I'm joined with my co-host, Dr. Ofori, Eunice Cromwell, and Dr. Boachi. Eunice, I hear you have a question.
Yes, I wanted us to just clarify what gets done after the colonoscopy. So, Dr. Boachi, you spoke about when they have polyps, but what happens after they find polyps? They take those polyps somewhere and they test it, correct? Because they just don't. Yeah, so I know they remove it, but what do they do with it? If we could just let the viewers know so they can know exactly what happens when they see polyps.
Yeah, so once the polyps are removed, it will be sent for testing. So if it's based on what the test shows, that will determine how frequent the next colonoscopy will be. So if it's just a benign polyp, then it can be done in about 5 years. But if it's more of a adenoma or adenocarcinoma, which is more aggressive, then it will be.
Dr. Ofori, are you there?
Yeah, I'm right here.
Dr. Fur, you look very well.
I didn't
Are you
hear.
okay?
Yeah, because I couldn't hear any of the things that was going
Oh,
on.
I think Dr.
Okay.
Wachi is back now. Dr. Wachi, you were saying.
Oh yeah, sorry. So I said yeah. So based on what they find in the polyp will be removed, and then it will be sent for testing. So basically, based on what they find on the polyp testing, then that will determine how frequent they will repeat the colonoscopies. So if it's benign and not aggressive, then the time will be a bit longer. But then if it's an aggressive cancer like adenocarcinoma or adenomas, then that will be a sooner repeat of colonoscopy, maybe once a year or every 2 years.
Okay,
And then
Dr. Fur.
what cause?
Go
Oh,
ahead.
I'm sorry.
Go
What
ahead.
causes benign polyps? Like what is the reason why somebody would get a colonoscopy and perhaps have polyps?
So most of the time, polyps are formed. We don't really understand how and why people get it. But like I said, most of the risk factors that will cause the colon cancer of these polyps, like I said, are the red meat diet, being obese, fatty foods, lack of exercise. Those will increase your chance of getting the polyps, and sometimes these polyps will turn into cancer. So if you can, like I said, and also of course genetics has a role to play, but the actual cause is unknown. But most of these risk factors can contribute to these polyps and cancers.
And do you think, I know earlier you said in your statement that there were more men that were getting colon cancer than women, but what I read today online, they were saying that they found that it's kind of an equal amount. I think in the last 10 years, they found that women and men are kind of getting it equally. Do you know the reason why more women are now getting colon cancer?
And that's I mean, of course we have to plan to look into the age as well. So I'm
Mhm.
not sure which research was that, but I'm pretty sure age has some to do with it as well. But I'm not really for sure exactly why women are getting it more. It could be based on these risk factors that we mentioned. And I think I also read somewhere about hormones as well, like estrogen
Oh,
when
okay.
once you hit menopause. I think there was a research a few years ago that talks about having low estrogen and going through menopause is also a risk factor for that as well. But that
Mm,
I'm not entirely sure. Yeah.
thank you.
Dr. Fori, any questions for Dr. Bwachi?
So I think one comment he mentioned was the genetics, which a lot of us don't have control over. There's this part of that disease that called a Lynch syndrome, which is pretty much um, a group of people that had the same last name, and they realized that there's a trend in their family history with the same kind of cancer. So family history plays a major role. So one thing that we will probably ask um, listeners is that you can look through your immediate family history to see what, if there's any chance that you have anything like that, and that will kind of make you aware that there's a need for you to start looking into seeing a physician or a primary care person to start screening. So I think that is something that we want to throw out there. Now, the question I had is that is there any relationship between colon cancer and prostate cancer, like in terms of predisposition?
So there's no specific correlation between the two cancers, but we do
Okay.
know that most of the same risk factors can cause. So most of the same risk factors that causes other cancers will cause most of the cancers. So there's not really exact correlation, but we do know that colon cancer can spread into the prostate and prostate cancer can spread into the colon. But I don't think there's any primary correlation between the two. But thankfully, though, checking for one will also check for the other. So checking for the
Right.
prostate, most of the time you can also check for the colon or at least the rectum, and that can
Right.
give you a sense of what is going on.
Right.
Dr. Afori, with the what you were talking about with the genetics and the Lynch, does that also include pancreatic cancer, like those symptoms? I kind of read somewhere some time ago that when people have predisposed to whatever the Lynch is, it's a group of different cancers that you can get. I believe pancreatic cancer was among one of them. Is that accurate? Oh, I don't think he can hear me.
Dr. Corey, can you hear us?
Oh, okay.
Okay, he might have to leave and come right back.
I can't hear Eunice, so yeah, I'll leave and come back.
Okay. Yeah, Dr. Boachi, I wanted to ask you in terms of treatment. So we have only the surgery and chemotherapy, right?
Yeah, so surgery is very important because if you find it, you have to get rid of it before it starts spreading. Now, if it has already spread to the lymph nodes and other locations, then if you cannot resect the whole part of the colon, then you add the chemo or the radiation to it. But the definitive treatment is to remove that part that is cancerous. And of course, if it has spread, then you do the chemotherapy and the radiation to shrink that part. But sometimes it has spread to other places that even if when you remove it and you do chemo and radiation, it will still come back because it's not possible to remove your entire colon from your body. Yet, of course, you do get a bag, colostomy bag. But yeah, so surgery is always good if it can be done. If it's stage 4 and it's already spread and it's too late, then chemo radiation for sometimes just for pain control because it can be very painful. So then sometimes if there's nothing they can do, they just do the chemo, not to save your life, but just to help with pain control.
So with the surgery, I understand they can do bowel resection, and then they can also have the colostomy, right? So are those for the surgery? Are those the only two kinds that can happen?
So I didn't hear the last part of your question.
So I'm saying for surgery for colorectal cancer, they can have the bowel resection, right? The intestine resection, or they can have the colostomy bag.
Hey, so the bag is just for you to have a way to get rid of your stool. So after the bowel resection, then they will create the bag on your side so that you can have a way. Because then once you remove the part of your colon, it's not going to function very well, and sometimes it will not come through your rectum and your anus to get rid of it. So sometimes they will put a bag so that you can have a way to eliminate the waste that you make through your colon. So the colostomy is not the surgery; it's just the outcome of the surgery.
Okay.
Yes.
Okay. So what are the prognosis? What if cancer should attack an organ, and then with in comparison with colorectal cancer, is colorectal cancer prognosis better than when the cancer attacks an organ?
So, like was said earlier, so it's all based on what stage they find it, right? So if it's an stage 1, 2, or 3, and it's easily removed, then your chance of survival is very, very high. But if it's had already spread to other parts of your body, then your chances of surviving are very, very low. It also depends on what kind of risk factors that you have in terms of obesity, heart disease, diabetes. If you're also a smoker, all these risk factors will decrease your chances of surviving after the diagnosis. That is why it's very important to maintain a healthy lifestyle, even in your young age, middle age, and as you get older. Maintaining a healthy lifestyle will always help you. It's like an insurance into the future, so that if any of these unfortunate diagnoses should happen to you, your chances of survival will be a little bit higher. And of course, age is also an issue as well. So if you're found at a younger age and it's found early, then you can recover from the surgeries and do well with the chemotherapy. But as you get older and your immune system is already low, any chemotherapy or radiation and surgery can even be harmful to you as as an older person.
Right. A viewer has a question. Senna Alinko is asking, please, what causes gas issues and what are some of the steps that can be taken to help with it? Dr. Watch.
So gas issues normally is due to too much bacterial in your GI tract. So based on what you eat, you can get increase in bacterial production, and then there's the bacteria that make all these gases. So the biggest prevention is to make sure you are eating enough fiber in your diet, to move your stool, make sure your colon and your bowels are moving just fine. Good hydration, good fiber intake into your diet. You can also take yogurt, has some probiotics in it, that can increase the production of good bacteria in your GI tract. If you can buy some of these probiotics as a tablet, in over the counter stuff, that can also help. In the case it's very uncomfortable that you have to pass gas all the time, then medications like Beano can help with that. But the prevention is, like I said, it's always better. It's always better. So high fiber diet, high yogurt to increase your probiotic intake will always do you more good than to go in the medication route.
Thank you, Dr. Boachi. Co-panels, do you have any more questions for Dr. Boachi so that we can let him go from here?
Yeah, actually, I was going to ask earlier, Mausi, you mentioned about our culture differences and how people from back home, if they're having problems with constipation, they want to do like herbal things or they want to do laxatives. One thing I wanted us to address here is, there is a certain danger that comes with too many laxatives and enemas and the rest. So could you just speak on that a little bit? Because I get people who ask me about this all the time and they have their own concoction, ginger, pepper, and some other things. And I always tell them that it's nice to be regular, but sometimes too regular can also cause problems. So what do you think about that?
Well, yeah. So taking too much laxatives, of course, has its own problem. So then, if your bowels are moving too much, in itself can be a problem, because then after a while you can start having severe belly pain. Also, if it's of course, sometimes on autopsy or sometimes even on colonoscopy, you can see those who have been taking laxatives for a long time or Sue softness, their colon actually is a little bit darker, and that's how you can tell that they've been taking too much of these medication. And in itself can also be an issue. All these medications do have side effects, so you just want to be careful about that. And then at some point, I know we mentioned about some herbal stuff that people take. We also have to be very, very careful, because at least in Africa, especially in Ghana, you've had a lot of folks with kidney disease taking all this herbal stuff that is not well regulated. So even though back in the day, growing up in Ghana, they will give you all these concussions to help you out. Sometimes too much of it can be a problem as well. But I've known people that have taken laxatives for every single day for many, many years, and once they go off for it, they are not normal again. So
Yeah.
it's better not to start.
Yeah.
But then if you need to take it as needed, then once in a while it's okay. But the biggest thing is to increase your fiber intake. But of course, increasing your fiber intake without hydration can make you constipate even worse. So once you eat your fibers, make sure you drink enough water to keep it flowing.
Pearl Yara Agboka has a question. If someone has other health issues, is it possible they can develop colon cancer at a point in time? Dr. Boachi, you can answer, or?
So it is possible. So like I said, one of the risk factors for this would be diabetes. So even though having diabetes can increase your risk of colon cancer, it is not a direct cause of the colon cancer. So yes, so other risk factors other diagnosis in terms of medical diagnosis can increase your risk factors of getting colon cancer, but it's not a direct cause. But of course, we do know that smoking is always an issue when it comes to cancers. So that's one thing you can prevent is to avoid smoking if possible.
Yes, and Dr. Boachi has been knocked out again. Dr. Ofori,
Yes, I'm here.
you are too quiet for my liking today. What's going on?
Well, I'm just listening to the good stuff, Yeah. Yeah.
So, do you want to take over from him?
Absolutely. I mean, I think one thing that we should all understand is that, like, cancer is a disease that, like, the way we used to think about it is like a death sentence, right? So right now we know that there's a lot of advancements in medicine that can prolong people's health. There are certain cancers that are very drastic, and colon cancer is not one of them. It tends to have a longer period that, as you can see, the Black Panther guy, he was able to live with it, compared to pancreatic cancer or any type of cancer. If you get it at a late stage, it tends to be very deadly. So, I mean, basically, that's the only comment that I have about the topic.
Okay. Is there any other question?
Well, I had a comment, and I know this will sound a little crazy, but someone actually told me that the way when you go to, you do the number one, number two, I mean, the way you sit on the toilet, right, has a role to play with whether you're going to get colorectal cancer or not. Okay. I'm not sure. Maybe Dr. Bachi can help me out here. Secondly, there's a speculation that people, I mean, of certain religion that wash, that area after they use the bathroom tend to have decreased chances of getting colorectal cancer. I don't know if they still can hear me though.
We can hear you.
Okay. So I have two contents. I don't know how true they are.
But Dr. Boachi is not. Dr. Boachi, okay, he's joined us again.
So the question was how you sit on the toilet plays a role. That's what I heard.
There's a discussion, and I don't know how, if you've come across any information or read about it, you can share with us. But there's a general perception that if you squat on the toilet or whatever it is, it reduces the strain and possibly having any kind of colorectal cancer, what do you call it, hemorrhoids, all these kind of GI conditions. I don't know how true that is. And then the second.
So it is.
Go ahead. Maybe then I'll
finish this. So it is partially true, right? So there's a lot of research that have shown that actually squatting on the toilet is much better. It helps you with the flow of your GI tract. It also prevents you from straining. So of course, the more you strain, the more you damage your lining, and the more as you repair your lining, you can get some of these cancers going on. So squatting is always better if you can, but most places we don't. It's weird doing that. Back home in Ghana might be a little bit easier because of how it is set up. But yes,
so it means you've been doing it the right way back home, right?
Yes, we have been. Even though it's a little bit scary back home, we have been doing it right. Yeah. And what was the second question?
So the second question was that there's certain religious people, I mean, I'm not going to say anybody, but we all know, that wash the place after they use the bathroom, right? With water and pretty much tend to have decreased colorectal incidence among those kind of people. I'm not sure if you've read anything in relation to that.
I have not read anything like that, but I mean, it kind of makes sense, right? So any trauma to that area can increase your chance. So whenever there's a trauma, your body has to heal, right? So if it's recurrent traumas, then your body has to replicate fast to heal. And of course, we just know that cancer is cells that is replicating very fast out of control. So of course, if you wipe and you wipe very aggressively, then you can have some tears down there, and then it will have to heal itself. And then sometimes by overhealing itself multiple times, then that can cause that. But I don't think it plays a very significant role. But I don't know, especially when you go to Ghana, the toilet paper that they use in Ghana is very, very hard. So of course you always want to go for a softer option, or use these baby wipes or wipes that helps a lot. But washing can help. But I'm a big fan of wipes instead of the regular toilet paper, because it does help decrease the trauma that happens in that area.
Right. Dr. Boachi, Lawrence Dagadu has a question. What are the benefits of using bidet? Is it bidet or bidet? BIDET. What is that? Is it Ventura he's trying to say? I don't know what a bidet or bidet is. Miss Eunice, do you know what a bidet is? BIDET?
Actually, I'm looking it up. It looks like it's a low oval basin used for washing one's genital or anal area. So it's a specific type of toilet.
Oh, I mean, if it's just for washing, then I guess that should be just fine.
Yeah.
Yeah. If it's just for regular washing, then that's fine
It's
too.
like a base. Oh, looks like you sit there when you have a bowel movement. Perhaps the water comes up and it's able to wash that area afterwards. So kind of what Dr. Ofori was saying about how people would prefer to just like wash that area versus using toilet paper or even the wipes.
So actually, one of these new some of these new toilet flushes do that now, especially in Japan, and I know in Ghana I've seen a few in Ghana as well, and in America.
Oh.
So you just sit on it, and instead of using paper, you just hit the flush, and it will just actually aggressively and nicely wash that area for you without using any paper. So I mean, I guess you can use that, and that can help.
Okay. Helen Yarakbali says, trauma from wiping. Doc, do you know our LGBT people experience a lot of trauma, right?
Yes, they do, and that is why rectal cancer is very high in that population.
Okay.
Mainly, partially from the trauma, but also from human papilloma virus, which we know is the HPV is spread mainly by boys. So we've had a few rectal cancers that is due to the HPV, in addition to the trauma to that area. So that is a well-known.
Oh, go ahead, sir.
Yes, so I said that's a well-known risk factor for that as well.
Thank you. So are there any vaccinations or medications you can take to prevent?
But there's a difference that Mausi, I'm sorry, Mausi, what I was going to say is that there's a difference between colon cancer and colorectal cancer. I think that we forgot to say that in the beginning. So, there's two different types. So I believe if it's colon cancer, colorectal cancer comes afterwards, right? When it spreads down to the rectal area. So there's two different ones. I have seen people who have just colon cancer and, you can be treated. But I believe when it gets to the colorectal stage is when it's already metastasized. Is that correct, Dr. Boachi?
Yes, that's correct. Yeah.
Okay.
Okay, so we don't have any questions yet. Any more questions? We will take a break, and then Dr. Boachi will give us his last remarks, and then we'll let him go. He's at work, so stay tuned. We'll be right back.
Yo, what's up, world? This be your boy Agbeshide Nanya, aka Gang Boss, aka Mr. Roro. Right now, I'm live on Trans Africa TV. Keep it locked, don't touch it. Ewe, Gang Boss, 1 year second.
What it do, my people? It's your boy Kingsley Ego B, aka King the Preacher, aka the Peacemaker, aka the joy of the people is my peace of mind. You are now watching Trend Africa. Don't touch that dial. If you won't touch her. Come on there. Keep watching Trend Africa. We are here. Africa has come to stay. Don't touch that dial. One love. Keep watching. Ratata.
It's here for me, Chiamo, God's afternoon. Yes, fellow Ghanaians, this is a public service announcement. No need to get excited. Your watch it stays the same. It's in the brown box now. Look at it right there in the green leaf. Beyonce sign. Why? Mamunsru. Yep, rocks watch it. The watch it in a jar, that's a specialist. Ja, you see, yep. We got a huge contract. This is for hotels and folks from out of town. Yep. Mamunsru. Environmentally friendly. Stays hot. I got plastic. I gotta go. But this is not for you. I mean, you got a choice, but your choice, your watch it stays the same. It's Mamunsru. Rocks watch it. The original is there. In the Selcoma demo. Yep. Powder fufu kremu DM from so. Hey, who's that? Anyway, we open right now. It's lunchtime. The number to call is 0244-676742, 0244-797911. Rocks watch it to the world. Catch them and see a fan World Cup. Yes, yeah. Do be able to
Are you looking for photography service for your upcoming event? Is it a wedding, an engagement, or a special event? Look no further. Jojo Texan Images is here. Hire him today for great quality pictures, a quality service provided on the day, and a great personality. Jojo Texan Images is on social media. Follow him Instagram and Facebook at Jojo Texan Images or call him 312-450-5235 and book your appointments today. Jojo Texan Images. Simply excellent. Book him now.
Hello again, everyone. Welcome to the health segment on Trend Africa TV. I am being joined with my professional partner, Dr. Ofori, Mrs. Eunice Cromwell, and Dr. Boachi joining us from Cuba. Dr. Boachi, I want to thank you once again for spending time with us. But could you please tell us a little bit about your foundation?
Yes, my brother and I, right after medical school, we started the Gold Coast Medical Foundation in 2010. And so we just wanted to go back home and help our fellow Ghanaians out. So we've been taking trips to Ghana since that time. Normally we take medical students, nursing students, and nurse practitioner folks, and we just provide free medical care. Everything that we do is free to everyone. So we try to go to at least 5 different regions in 4 weeks. So it's a very mobile event. So we're supposed to this year we're supposed to go to Tamale, Ashanti region, Cape Coast, and some other places, but COVID happened. So basically, we do regular routine medical care screening. We provide them with medications if they need to, whatever that we cannot do when it comes to surgery or ultrasound or mammogram. We will pay for the folks to go have it. We always work with other groups that are going to Ghana as well. We work with a lot of the churches as well. In addition to the medical care, we also have a dental. We're supposed to use a dental group that will be coming with us to do free dental care. Last year, we sent an ambulance to the Menchia Dixon Hospital to help them out. We also have 40 orphans that we take care of in Oyoko, in Ashanti region. It is called the Westphalian Children's Home in Oyoko. We provide them with free medical care every year, school supplies, food items, and new clothing. We also work with Cerebral Palsy Ghana. Every year we host a conference on cerebral palsy at the Menswick Hotel in East Legon. And we just provide them with most of the issues are seizures and lack of transportation. So we provide them with wheelchairs, seizure medications, and anything else that they would need. We also work with the School of the Blind in the Kuapem area that we supply them. We did help them with their library, and we were able to visit them last year. So that's what we do. So next year, if all goes well, God willing, we will be normally we go at the end of May to June. That's when most of the students are out of school. So every year we take between 20 to 37 students from America, and then we all meet up in Ghana for this trip. So every year we're always looking for partners. We're always looking to expand. Of course, collaboration achieves most of our goals. So if you or any of your listeners or anybody out there that would want to be part of our program, we are always looking for help. So hopefully next year we will definitely go next year. I'll be going in December to take up the groundwork before May comes around.
For we the health workers, if we want to, is there a chance for us to collaborate with you? And
Yes.
If there is, how can we get in touch with you?
Yeah, so I will give you you have my email. I also give you my WhatsApp number,
Okay.
which is 347 because of where I am, it only works via Wi-Fi and WhatsApp. So um, I don't know if you can show up my email on the screen, but the email is kbmd2012 at gmail. But the phone number will be the best way on WhatsApp will be the best way to get hold of me. So, and I can repeat the number again. It's area code 347-647-0725.
Okay. Okay. So
And then we also have a Facebook page that you can check out, Gold Coast Medical Foundation. We also have the website, thegcmf.org, thegcmf.org.
I think Eunice will be updating the page viewers with all this information.
Okay.
So Dr. Wachi, do you also take donations, or can we give?
Yeah, so we take any and every donation. So we take cash. We take which you can do that through the website. We also take any medical supplies. We just got
Okay.
20 hospital beds that we're going to be shipping soon to Ghana. So any
Wow.
medical supplies, any toys. We actually did for last year we did a toy drive for the Kolibu Pediatric Surgery Unit. So we were able to send them some gently used toys and new toys. Also purchase a TV for their recovery post-surgical recovery room. So we take all toys, computers, school supplies, use the new clothing, shoes. We take everything that we think they can use in Ghana. So once you contact us, we can make arrangements to either pick it up if you're in the East Coast area, or find a way to mail it, and we pay for shipping. So.
Wow.
Yeah.
Please just go ahead and write my name down. I'm coming, and then
Definitely.
Trend Africa will be covering live.
Yes, that would be great. That's what we need. Is we don't get enough media coverage, so most of
Exactly.
our
I
work
know. So what
goes
is your
unnoticed.
last
Yeah.
what is your last message to our viewers, Dr. Wachi?
So my final message is that this colon cancer issue is a big deal. We have to take it seriously. We should take it very seriously. If you have any symptoms, don't wait. I mean, I know sometimes we have the annoying patients that come to the clinic every single week. That is fine. If you have any symptoms, if you notice some blood, please don't wait too long. If you notice any change in your stool, don't wait. If you have fatigue, if you're always tired, if you feel like you don't have energy, anemia can cause that. So just whenever you start having those symptoms, don't wait too long. Go get your basic blood test done, and then your provider can guide you through that process.
Thank you so much, Dr. Wachi. I'm going to let you go now, but you are forever our friend now. We're going to be chatting behind back doors, and Eunice and I, we don't sleep, so we'll be getting back to you.
And hopefully we can do this again soon. Hope we can do this again
Definitely.
on different topics. So
We
whenever
need
it is,
you.
just
We
let me
need you.
know.
You have
Yeah.
really enlightened us today. Thank
Yes.
you so
Thank
much.
you. Thank you.
Thank you so much. Thank you for the invite.
Yeah.
And I
So
promise next time my Wi-Fi will be better next time. So I'll make sure my Wi-Fi is.
that's okay. That's okay. So
Yeah.
well, viewers, we're gonna let Dr. Boachi go now, and then Eunice and I and Dr. Ofori will bring the program to an end. Eunice, what do you think of Dr. Boachi and your closing remarks?
I think he's brilliant. I'm so grateful that he was able to join us. This issue, Mausi and I really spoke about this. This was something that was really heavy on our hearts. So we'd like to take this opportunity to just give our deepest condolences to the family of everyone who's going through something like this or who has even lost a loved one. I hope that this program has enlightened you. And I hope that the symptoms and things that we go through, we won't feel so uncomfortable to share it with people. I always tell people that even if you are embarrassed to say something, feel free to please text me and ask me anything. I may not know everything, but I do have a lot of resources, and we do want to really be able to help. That is the reason why we developed this program in collaboration with Ghana National Council and Trend Africa TV. So I'm hoping that people will really take this time every other Thursday to really tune in and just express what's really going on. Again, you don't have to post your very personal questions. You can always contact us. We can always find providers to call you and discuss these topics, but I don't want people to feel like they are living alone with things that they could have told a doctor, especially if you don't have a primary care provider. So that is what I will always say. It's always a blessing, and I'm always so grateful to be on this program every other Thursday. It's something that I really look forward to. My kids are always like, "Oh God, Mom's going to be on the TV again talking about healthcare," but it's my life. It's what what I studied so hard in school for. So thank you very much for this opportunity, and to all of our viewers, thank you for tuning in. Make sure you're letting us know what your topics are, and of course, don't forget we'll be having our first virtual health fair on October 22nd. And we are gathering lots of healthcare professionals to give you very, very vital information. So please stay tuned.
Could you please mention that the date again for the Health Expo? Is Dr.
Yes.
Boachi going to be on the Health Expo?
Yes, he's actually coming to give a presentation on chronic kidney disease and hepatitis.
Oh,
so
wow.
very, very important information that we can all learn from. As everyone heard everything that he was saying that he's doing with the Gold Coast Foundation, these are people that we really need to get involved with. To all of our healthcare professionals who want to, give back to Ghana, this is a good organization that you can join and travel with and get some experience. So very, very excited to have him on board. And our health fair is going to be Thursday, October 22nd. And we'll use the same time frame, our 6 to 8 o'clock time frame, have a lot of different professionals giving presentations. And then hopefully if we can get our Zoom working, we'll be able to have more audience participation and people can log on and talk to us.
Thank you so much, Mrs. Eunice Cromwell. When Mrs. Eunice Cromwell says she has a lot of resources, she does really have a lot of resources. There's no question I've asked this woman where even when she says she doesn't have it, she goes and research and gets back to me. I call her my personal angel. Take advantage of people like this who are just willing to help the community. Eunice, we love you so much.
Thank you.
My regards to the family.
Thank you.
Dr. Ofori, what do you think of Dr. Boachi, and your closing remarks, please?
Awesome presentation today. This was a topic that, it kind of catches all of us to a little halt, like how our colon can actually pose such a, threat to the human health. So what I would say is that this shouldn't be one of those where, because a superstar died out of it, we will create awareness and then we will stop. So I think we should continue to let people know, in addition to other cancers such as prostate cancer and breast cancer and things like that. One other thing I would say to listeners is that if you really watch closely, every cancer, the number one predisposition factor is obesity, right? And our lifestyle, like how we eat and how we exercise. So we can actually reduce a lot of cancers by just trying as much as possible to watch what we eat and then how active we are. So in my closing remarks, I'm going to say that let's keep staying active. Make sure that we eat very good diet. We don't reduce the weight, smoking, alcohol, and all those things kind of predisposes us to a lot of cancers. So I will meet you guys next 2 weeks, and we can talk about health. Thank you.
Are you going to be at the expo?
Yes, I will be at the expo. I might not be presenting, but then I'll be there to support the
support. Okay.
Yes. Mm-hmm.
That's okay. Have you started getting tested for prostate, colon, anything? Do you get tested?
No. So
you're still young, right?
Yeah, but I wouldn't mind doing it. Looking at a 10-year margin, if it's negative or whatever it is, I don't mind doing it. But I do go for routine checkup every year, which is something that a lot of our folks back home don't have that privilege, or is not something that we think about. He said that he went on a mission trip, right? I have had a lot of people go on mission trips, and the things that I hear sometimes baffles me. We don't have preventative care in Ghana. And again, I always talk to my people back home because that is where we lack most of these things. So please go check up every year. My dad used to do that all the time, and may his soul rest in peace. But he really lived long, you know. And one of the things he always said was that it's like a car, right? You take it to the mechanic once a while. So you have to always check in with the doctor and make sure that you're doing fine.
Thank you so much, Dr. Ofori. That is our one and only handsome Dr. Ofori. Thank you so much, Dr. Ofori. My love to the family. Thank you.
Same to you.
Okay, viewers, thank you so much for joining. Today on the feed. Please share, and educate someone. You might never know what somebody might be getting from this feed. I don't have to undress and flap my boobs to get numbers. I'm not going to do that. We are going to continue to educate the community, and it is our personal responsibility to give back to the community. So some of us have been through a lot, and we have gotten where we are from people advising us in the community and helping us in the community. So it's just right that we give back to the community. That is why we want to thank GNC and Trend Africa TV, you know, for collaborating to bring us all this information every other Thursday. We also want to thank the Ghana Physicians and Surgeons Foundation for providing us all these surgeons to come and give us all this information and inform us on how to move forward with our lives, preventative care, treatments, and all that. Trend Africa TV, redefining Africa. We're going to see you again in 2 weeks. Thank you so much for watching. Good night.
To advertise with us, donate sponsorships and suggestions, email us at trendafricatv@gmail.com or call us on 773-312-0318 or 773-756-6678. Remember to also follow and like us as Trend Africa TV on Facebook so you can always catch us live. On Instagram as Trend Africa TV 123 or subscribe to our YouTube channel as Trend Africa TV and click on the notification button to watch previous shows. You can also visit our website for your African news, entertainment, fashion, and sports updates on www.trendafricaonline.net. Trend Africa TV, redefining Africa.